Hello, we're going to talk about the muscles of the glenohumeral joint and muscles that only act on the glenohumeral joint. So these include the deltoid, coracobrachialis, teres major, and the four muscles of the rotator cuff group, teres minor, infraspinatus, subscapularis, and supraspinatus. We will start talking about deltoid. It is traditionally separated into three different divisions: an anterior head, a middle head, and a posterior head. But it's actually been divided into 7 different divisions, each separated by fascia and able to contract individually. But for functional purposes and traditional purposes, we can stick to the 3 major heads. The proximal attachment includes the lateral third of the clavicle. That is the attachment for the anterior head. The acromion of the scapula. That is the primary attachment of the middle head. And the spine of the scapula, which is the primary proximal attachment of the posterior head. Distally, they converge to the deltoid tuberosity of the humerus. That is approximately halfway down on the lateral surface of the humerus. Actions of the deltoid. The anterior fibers can perform flexion of the glenohumeral joint. The fibers run anterior to the medial lateral axis. Therefore, they can perform flexion of the humerus at the GH joint in the sagittal plane. Posterior fibers can do extension of the GH joint. They run posterior to the medial lateral axis. Therefore, they can pull posteriorly on the humerus, causing extension of the humerus at the glenohumeral joint in the sagittal plane. Anterior fibers can do medial rotation of the glenohumeral joint. Fibers run from lateral on the humerus to medial, where they attach on the clavicle. In the transverse plane, they can rotate the anterior surface of the humerus towards the midline of the body. Therefore, they can do medial or internal rotation of the GH joint. Posterior fibers can do lateral or external rotation of the GH joint. Those fibers run lateral on the humerus to medial on the posterior part of the scapula. When they contract, they would rotate the anterior surface of the humerus away from the midline of the body, therefore producing lateral or external rotation of the GH joint. The middle fibers are lined up to do abduction of the GH joint. From a frontal plane view, they would pull the humerus laterally or away from the midline of the body along an anterior-posterior axis. Therefore, middle fibers can do abduction of the GH joint. And then finally, adduction of the GH joint. Both the anterior and posterior fibers, and even more specifically, the most medial of the anterior fibers and the most medial of the posterior fibers, can pull the humerus towards the midline of the body in the frontal plane along an anterior-posterior axis. Therefore, the anterior and posterior heads can do adduction of the GH joint. So we can see between the use of all 3 major heads of the deltoid, it can do any of the 6 fundamental GH motions from anatomical position. If we start from out of anatomical position, if we start flexing the shoulder at 90 degrees, then we also have the 2 motions of horizontal flexion, moving the arm towards the midline of the body in the transverse plane of the body, or horizontal extension, moving the humerus away from the midline of the body in the transverse plane of the body. And the anterior head of the deltoid can perform horizontal flexion, also known as horizontal adduction. This would be similar to the movement of a wide grip push-up or bench press. And then the rear deltoid or rear head of the deltoid can contribute to horizontal extension or horizontal abduction of the humerus in the transverse plane of the body. Next, we have the aptly named Coracobrachialis. It has a proximal attachment on the coracoid process of the scapula and a distal attachment on the middle medial surface of the humerus, which is directly across from the deltoid tuberosity, which serves as the distal attachment of the deltoid. Actions of the coracobrachialis include flexion of the GH joint. In the sagittal plane, the fibers run slightly anterior to the medial lateral axis of the GH joint. Therefore, it can produce flexion of the GH joint. Adduction of the GH joint. From the frontal plane, the fibers run medial to the anterior-posterior axis. Therefore, it can pull the humerus towards the midline of the body at the GH joint, which is adduction. And horizontal flexion of the GH. So this is a motion outside of anatomical position. So if the arm is flexed at 90 degrees and the muscle contracts, it will pull the humerus towards the midline of the body, which is horizontal flexion or horizontal adduction of the humerus at the GH joint. Teres major has a medial attachment on the inferior lateral border of the scapula and a lateral attachment on the medial lip of the bicipital groove, also known as the intertubercular groove. Actions of teres major are actually the same glenohumeral actions as latissimus dorsi. So we have extension of the humerus at the GH joint, which is a sagittal plane action along a medial lateral axis. Medial rotation of the GH joint. So the fibers actually run along the medial side of the humerus and attach on the anterior side. Therefore, they can rotate the anterior surface of the humerus medially in the transverse plane, which is medial or internal rotation. We have adduction of the GH joint. So it will pull the humerus towards the midline of the body in the frontal plane, which is adduction of the glenohumeral joint. And then finally, horizontal extension of the GH joint. So when the arm is first flexed to 90 degrees, teres major can contract and bring the arm away from the midline of the body in the transverse plane of the body, which is horizontal extension or horizontal abduction. Next we have teres minor. Teres minor gets its name because it looks like teres major, although they are not going to have the same actions. Teres literally means round. The muscles aren't really round as far as they are not spherical. They are more of a semi-cylindrical shape. The medial attachment for teres minor is along the middle region of the lateral border of the scapula, which is immediately superior to teres major. And then the lateral attachment is on the inferior facet of the greater tubercle of the humerus. Actions include external rotation of the GH. So unlike teres major, teres minor attaches to the lateral anterior side of the humerus and wraps around laterally. Therefore, when it contracts, it rotates the anterior surface of the humerus away from the midline of the body within the transverse plane, which is external or lateral rotation of the GH. And then also adduction of the GH joint. It has the same line of pull as teres major in the frontal plane, just a little bit less leverage, but it can draw the humerus towards the body in the frontal plane, which is adduction of the GH joint. Infraspinatus. So as the name implies, it lies underneath or inferior to the spine of the scapula. It has a medial or proximal attachment on the infraspinous fossa of the scapula, which covers most of the posterior surface of the scapula, and a lateral or distal attachment on the middle facet of the greater tubercle of the humerus. And then it only has one primary action, at least from anatomical position, which is what we are focusing on, which is external rotation of the GH joint. So it wraps around the humerus laterally, similar to teres minor. So when it contracts, it rotates that anterior surface of the humerus away from the midline of the body, which is external or lateral rotation of the GH. Subscapularis. So this is a muscle that attaches underneath the scapula, hence the name, although more accurately it lies deep to the anterior surface of the scapula. So the medial attachment is on the subscapular fossa of the scapula, which is most of the anterior surface. And the lateral attachment is on the lesser tubercle of the humerus. It has a similar line of pull as the teres major in the fact that it runs along the medial surface of the humerus to attach anteriorly. From anatomical position, it has only one primary action, which is medial rotation of the GH joint, meaning it will rotate the anterior surface of the humerus towards the midline of the body in the transverse plane. And the last muscle of this section is supraspinatus, which literally means superior to the spine, or in this case, the spine of the scapula. It has a medial attachment in the supraspinous fossa of the scapula, which lies at the top of the scapula, just above and anterior to the spine of the scapula, and a lateral attachment on the superior facet of the greater tubercle of the humerus. It has only one primary action in anatomical position, which is abduction of the humerus at the glenohumeral joint. It is lined up directly with the frontal plane of the scapula. And if you look at the frontal plane, or what is considered typically to be the frontal plane of the scapula, it is roughly 30 degrees off of the frontal plane of the body. So using our general definition of flexion of the humerus relative to the body or along the sagittal plane of the body, it might actually contribute somewhat to flexion as well, but the primary action for our purposes here will be abduction at the GH joint.